AI technology is catching on in many industries, and that includes healthcare. Dominique O'Neill talked with some experts at ProMedica and joins us in the newsroom now. Dominique, while there are some benefits here, you're learning there are some concerns as well.
Well, Amanda, I learned that AI in healthcare is simply this. Information and data is used to identify patterns and make predictions, and that creates privacy concerns for patients in terms of medical history, family history, and lab tests.
Dr. Brian Miller is the Chief Medical Information Officer with ProMedica. He says the biggest issue with AI in healthcare is how quickly the tech is being adopted. Dr. Miller says the healthcare provider is working to ensure the best for the patient.
So we've adopted a fast follower attitude toward this. So we vigilantly monitor the cutting edge of technology, but we only deliberately implement and roll out the tools that are out there long enough to have proven effectiveness, and they're safe for patients, and they're sustainable and stable.
Dr. Miller says the next thing in AI is called Ambient Addiction. The process includes a microphone and is connected to a computer which gathers the patient's data in real time during an appointment, allowing doctors to focus more on the patient.
I can review it and vet it, and it's much more efficient, and it's just as good a care, but our experience is much better, and we're bonding, we're creating a relationship, and that's important in healthcare as well. And that's a really exciting one for us, and that future is now, that's coming now.
Dr. Miller says there are dozens of tools in ProMedica's clinical setting that can help physicians treat patients more effectively.
And so we have AI models right now that are analyzing every patient in our hospital and all the data about them minute by minute. And they're helping us identify really important things like deterioration, because we know that sick patients can suddenly get very sick very fast and unexpectedly. And they're helping us identify things like sepsis, which honestly is probably the most common worst thing that can happen to you in a hospital.
Dr. Miller says another important thing patients should know is artificial intelligence is not a replacement for the human interface.
We still have people that need to be doing this work, and it's just a tool to help them be more efficient. Everybody now working to the top of their license, move away from the clerical and the menial tasks and the repetitive tasks, and can be more interactive and engaged with our patients in a more meaningful way.
And Dr. Miller says ProMedica has tools that helps healthcare workers predict when a patient might not show for a visit, which can help break that pattern. Reporting in studio, Dominique O'Neill, WTO11.